Now, here's Kanji.
Today is Diabetes Alert Day. Diabetes is a chronic disease that impacts more than 13% of the population in the tri-state area. It can have serious complications, and experts say millions of adults don't even know that they face that diagnosis. And to discuss that and more, we are live with Dr. Nakia Sellers, who is a certified diabetes care and education specialist. Thank you so much. This is great.
Thank you so much for having me. And so it is the great day to be here since it is Diabetes Alert Day. So thank you. And so this is the time that the American Diabetes Association observes this day to promote diabetes awareness so people can know their risk and also know like signs and symptoms of diabetes.
Okay, so you founded the Diabetes Care and Wellness program. What separates what you do from others? I mean, it sounds very specialized.
So at Diabetes Care and Wellness, this is an adult private practice. We're located in West Memphis. And so for the last 10 years, I have been a specialist in diabetes. And so that's what sets us apart. I'm board certified in advanced diabetes management. And so at Diabetes Care and Wellness, we take the time to make sure that you know about diabetes, make sure you know what your A1C should be, know what things to limit or avoid, not necessarily avoid, because one thing I like to tell people, so many people come to me and say, well, someone told me or my provider told me not to eat this, not to do this. But one thing we want to make sure that we're telling patients living with diabetes or people living with diabetes, it's still okay to do certain things. We want you to live well and live healthy. We just have to do some modifications or do things in moderation.
Okay, you have a setup here, and I think that you're going to help us explain. Can you show me what's going on, what you're working with here?
So one thing, when I talk to patients with diabetes, type 2 diabetes in particular, is learning to eat a little bit healthier, and that's one of the reasons why we have our event coming up March the 3rd of our Grow Healthy, Live Healthy, just trying to give people the tools and equip people with the tools to live healthier. So here is our portion plate. So this is a simple thing that people with diabetes can do. So half of your plate can be like green leafy vegetables. So there's things like greens, kale, spinach, green beans. Then you have your other half here, we're going to cut this in a section, and this is your protein. So like chicken, beef,
salmon.
Right, for sure. That is a very healthy option because it's a good fish, and so and also gives us brain food with omega-3.
Okay.
And so we say stay away from pork. Those things increase your blood pressure. And then you have the other section here, which is your carbs. So those are things like potatoes, rice, corn. Any type of potatoes, so I don't care if it's baked, smashed, dashed, or whatever, and also rice, any type of noodles. Those are the things that we want to limit. Not to say patients or people with diabetes can't have, we want to make sure we're limiting those things.
Because it's processed, right? It's not,
right.
So when you say carbs, you really mean they came out of the ground, but they have carbs, or?
Well, carbs are things that break down into sugar.
Right.
And so those are like your baked goods, so any type of breads, oatmeal, grits, even fruit. But one thing that I tell people, when you have that sweet tooth, instead of going for like the honey bun or cinnamon roll, so try like some berries or strawberries. So they're still carbs, but they're healthier for us. And so the berries also have anti-inflammatory.
Oh, we need that.
Yeah, and so with people with diabetes, often are at increased risk for heart disease, heart attacks, and stroke. So we can decrease like inflammation with these nice berries, and so that'll also help us live healthy as well.
Oh,
and so,
no, please, you.
So that's one of the things that we're going to discuss at our Grow Healthy, Live Healthy. We're going to have a local farmer who's going to give tips on home gardening. We're also going to have a healthy food demo with the nutritionist and have a fitness expert as well. And we know that sometimes we have to do things that are a little bit fun, so we have Stan Bell that's coming in.
Oh, Stan the bell ringer. So you did have the inaugural Honeyland Festival grant, and that's helping to put this on?
Yes. So Honeyland, they had a festival, and so I received the inaugural Honeyland Fund grant, and so that's when we bring on different creators who help to improve disparities like in certain communities, because we know in certain communities, certain zip codes determine your health.
Right, because we have one of the highest food insecurity locations in the nation.
We do in this area, and higher rates of diabetes as well. So that's why it's very important that we're doing this event to help improve those healthcare disparities.
Okay, so who is ideal to attend this event?
So it's not just for people with diabetes, it's for anyone. So if you want to learn more about healthy eating, want to have some information, and we also we'll be providing tools. Like I said, we want to provide tools and resources to help. So once you leave with this information, we want you to have some resources too. So we'll be giving away plants that help people grow their own home garden, and also different vendors that will be there giving information as well. So we also have sponsors like Aetna and Baptist who have been great to help promote.
Very quickly, what's the location of the festival? Just making sure.
So it's this Saturday at Tilden Rogers Park in West Memphis, and it's right about 5 minutes from downtown, and it's from 11 a.m. to 2.
Okay, perfect. Dr. Nakia Sellers, Diabetes Care and Wellness, thank you for sharing this important information on Diabetes Alert Day.
Thank you. Thank you.